ಹಲೋ
ಹಲೋ, ನಮಸ್ಕಾರ. ಹೇಳಿ ಸರ್.
ನಮಸ್ತೆ. ಪವಿತ್ರ is there? Pavitra, you please check your slides once.
Yes, sir. Can you hear me?
Definitely, I can hear you.
Yes, sir. I'll start now.
Yeah, once you check your slides also.
Yes, sir. Doing it. 1 second.
Okay. Yeah.
So I think you'll have to add me as a host.
Vinay, can you do that? Okay, I should do it. Okay, 1 second. Sure, I'll do that. I will do also as you as a co-host. Brian has joined. Good evening, Mr. Brian. A hearty welcome to you.
Thank you, Dr. Joshi. It's very, I feel very honored to be able to talk to your group today. Thanks for the invite.
Thank you so much for the time and accepting our invitation. We are expecting other people to join. And for information, this room can accommodate 100 people. At the same time, it is being telecasted live through YouTube channels. Around 1,000 pharmacists across the country are expected to join.
That's very nice. Very nice. Thank you. That sounds wonderful. Look forward to it today.
Thank you. Pavitra, can you check your slides once?
Yes, sir. Yes, sir. 1 second.
Yeah. I think that's good, Pavitra. We can see your slides.
Yes.
There is some audio disturbance in your computer, I think. Please check.
Yes, sir. 1 second.
Yeah. So how is the COVID situation in your country, Mr. Brian?
Well, it kind of varies a little bit across the country, but for the most part, numbers have been continuously coming down, which is great as the number of vaccinations have increased. So we see the correlation between the two, and hopefully it continues to be that way, and we don't catch any kind of new variant or any kind of recession back in new cases and so forth. But we have pockets across the country at different places. But overall, it's looking much better than it was a year ago.
Yeah,
And
situation. Yeah, please.
Well, yeah, I was going to ask. We hear news reports about India and how the challenge that you guys are facing right now.
No, the challenges are very high across India, and there have been a lot of rise in COVID patients, and now we are affected with one more problem, that is block fungus, which is really causing a lot of trouble, both for the from the healthcare sector and as well as for other people also. And the vaccination has been good in India, but the problem is the number is especially South India, the number is enormously increasing. It's a complete lockdown now from past almost a month. And I don't know when this will be out of this pandemic.
Yes, yeah, it's definitely a challenge, and we are experiencing now a plateau of vaccinations, and where the vaccine hesitancy has now come into play that we were predicting and looking for all along. And unfortunately, there's just a segment of the population that doesn't have the trust, or just doesn't want to do it for one reason or another. So that's the challenge that we have now, is trying to convince them to accept the vaccination.
Right. And as far as our India goes, there have been a lot of challenges for the pharmacy fraternity, but especially the COVID has really opened the eyes of the healthcare sector in the country, because as USA is fine; it was already established. But in India, the community pharmacy and other units of pharmacy, they were not completely included in the healthcare sector. But now, the pharmaceutical industry and as well as the people from pharmaceutical fraternity, they are really doing excellent. It can be healthcare, or it can be giving some kind of, the counseling to them. So now India has realized, the importance of pharmacists, and that's why we had requested you to kindly address our people. Because there is some kind of hiccup in the mind of I can say the doctors, because across the world, they always feel that they are the first-rate citizens, and then followed by the pharmaceutical people and nursing and all. Because yours is one of the oldest the organizations in USA, and in India it started it was there in the beginning, but as a team, it started very recently, around in 2007. So we are hopeful that our people will get a lot of benefits from your advice and talk.
Thank you. I hopefully we can create some insight and utilize some of the successes that we've had, and it could be somewhat of a foundation or a platform for you and your group as well.
Thank you. And before the other people join, a small information to you, Mr. Brian. Ours is an organization which is called the ACPI, Association of Community Pharmacists of India, and it was started in 2007, but we could start it in a little more practical way very recently. But we have the backup of a lot of organizations, like it is from Indian Railways Pharmacists Association. We have Government Pharmacy Officers Association. So we have IHPA. So many associations are there. When it comes to community pharmacy, yes, we have to change a lot, and we have to cultivate that professional way of dispensing and doing the professional activities.
I understand. Yeah. Challenges all the time, huh?
Yeah.
Good evening, sir.
Yeah, good evening.
Good evening.
Yeah, good evening.
President Joshi, if you don't mind, is my audio clear enough on your end?
Yes, the audio is very clear, and even the video
good.
also.
Good.
And in fact, you are looking very smart, other than your photo in our website.
I can try to look the part. That's maybe about it.
Yes. Vinay, can you check whether Dr. Nagappa has joined? The national Nagappa sir is here.
Yeah, I'm here.
Sir, welcome to you.
Thank you.
Good evening, Nagappa sir.
Good evening, sir. Good evening. How are you?
I'm fine, sir. How are yourself, sir?
Okay, doing good. A big meeting, a big event in ACPI.
Yes, sir.
Yeah, definitely. See, Nagappa sir, actually, the especially NCPA, it is one of the oldest organization in
Yeah, I know.
US.
I know
It
that.
started long time back, and Brian Caswell is, your leader in US, doing fantastic work for the pharmaceutical sector. And in fact, we are very happy that he has joined us within our request. Doug had been, in constant touch with us, and thanks to him also for arranging this meeting.
Yeah. So it should be given wide publicity after the meeting, content and all, press and all. It should be given wider publicity.
Yeah, in fact, there are some press reporters who have joined this. I welcome Siri and as well as Nandini also from the Pharma Biz. They're also listening to the talk. And we have people from Indian Express and as well as Times of India. I think Times of India is to join. It will be done, sir.
Not only in professional circles also, we must go up, like in SPAR, like in FIP, and all those things. I'll talk to you later. Because
Yeah, sure.
now we have to start the meeting.
I request all people to kindly mute your audio. Only those people who want to talk, they can kindly switch on their audio. Vinay, I think you are following YouTube, right? Because some delegates may pose some questions in the YouTube also. That can be, checked here once Brian's talk is over.
Sorry, sir.
So it's 6:30. Should we wait for 1 or 2 minutes or should we start? Yeah, we can wait for 1 or 2 minutes, right? Yeah.
Good evening, Dr. Joshi.
Good evening. Good evening.
Nagavi.
Sir, namaste.
Namaste. How are you?
Very good. Thank you.
Happy evening, Professor Nagavi, sir. This is Gopal from Pondicherry.
Gopalji, how are you? Very good evening to all of you and to you, to others.
Thank you, sir.
also.
Thank you, sir.
Nice
Thank you,
to
sir.
see you all
Pleasure hearing
here.
your voice, sir. Yes, sir.
Yes, yes, thank you very much. ಏನಪ್ಪ ಇಲ್ಲಿ ಅಂಕಲ್ ಇದ್ದಾರೆ. ಶುರುವಾಗುತ್ತೆ. ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಂಡಿದ್ದೆ.
Yeah, tell me now. We can start so that people will join. Why to waste the time?
Shall I start, sir?
Hopefully we can, we can go ahead.
Okay. So good evening, everyone. A hearty welcome to all the delegates, the guests for joining us today for this webinar conducted by Association of Community Pharmacists of India, ACPI, South India. ACPI is a non-profit professional organization started with an aim to provide patient safety by pharmaceutical care. The society was launched in the year 2007 with an objective to assist practicing pharmacists and to help patients to use medication safely and effectively. So, webinar will be on the topic of overview of community pharmacy practice in the US. Today, community pharmacists play an important role in any country as they take responsibility for patients' medicine-related needs for access to healthcare. However, in India, only the supply of medicines remains the core activity of community pharmacists. Most community pharmacists in the country still hardly offer patient-oriented service. The role of pharmacists in the community and with it, their medicine management may change in the wake of rapid growth of domestic medicine output and national healthcare expenditure. This webinar seeks to discuss the community pharmacy practice in US and sketches its education and training in future prospects. So now I call upon Dr. Hanumantacha Joshi, President, ACPI South President, Karnataka, to welcome the gathering.
Thank you, Pavitra.
Yes, sir.
First of all, a hearty welcome to everyone for the much awaited webinar on overview of community pharmacy practice in the US. And I take this opportunity to welcome Mr. Brian Caswell, President, National Community Pharmacists Association USA, for accepting our invitation and for coming here to enlighten the pharmacists across India what exactly is community pharmacy and how it is being practiced in the US. A hearty welcome to you, Mr. Brian.
Thank you, Dr. Joshi and President Joshi. I appreciate it. It's a great honor to be able to address you guys today. So thank you for the invitation.
Thank you.
I'll grab the share screen. Go ahead.
One second. Yeah.
That's
so
okay.
I also welcome the National President, Professor Anantanayak Nagappa, for all his support for conducting the webinars and making the team very active. A hearty welcome to Dr. Nagappa. And I also welcome our mentor and the guide, the person who is exactly behind for all the activities, Professor N. Udupa, who is the Executive Director of ACPI. And I also welcome my friends, from various organizations, that is All India State Government Pharmacy Officers Association, Karnataka State Government Pharmacy Officers Association, Karnataka Chemist and Druggist Association, then Indian Railways Pharmacist Association. We have Govardhan with us. I hearty welcome to you, Mr. Govardhan. And Department of Pharmacy, CFTRI, then ESI of Association, then Indian Hospital Pharmacist Association, and we also have Dr. Pavan Kumar, who is the Vice President of Telangana and Andhra chapter of South India, Dr. Arul Kumaran, the Secretary of ACPI, and as well as the President of ACPI Kerala, and our senior leader, Dr. V. Gopal, the President of ACPI Tamil Nadu and Pondicherry. And I also welcome Sri Ashok Swami Heror, a very vibrant and a very active pharmacist in South India, who have been very instrumental in doing a lot of campaignings for the sake of pharmacists. A hearty welcome to you. And Mr. K.V. Gopinath, an advisor to the ACPI, a practicing pharmacy officer, and our dynamic secretary, Dr. Srikanth, who is the secretary of ACPI, and all dear friends. And I am very sorry if I have forgotten some names. A hearty welcome to you. And we are very eager to listen to the talk of Mr. Brian Caswell. So we are very happy, and we have been conducting various webinars, once in a while. It is to bring the people together and to make a united team and to work for the profession. That is the idea. At the same time, we have, I would like to mention our deep condolences for some of the senior leaders who lost their lives in past 1 month, very seniors due to Corona. And that's what I wanted to tell you. And a hearty welcome to you. And before Brian Caswell starts, I request Dr. Srikanth to kindly introduce the speaker today. Thank you so much.
Thank you, Dr. Joshi. Now I call upon Dr. Srikanth, Secretary ACPI Karnataka, to introduce today's speaker to all of us.
Srikanth, are you there? Okay, you go ahead, Pavitra, with
yes, sir.
Okay, can you read the profile of Mr. Brian Caswell?
Yes, sir. So today's speaker, we have amidst us Dr. Mr. Brian Caswell, President of Walker Drug in Baxter Springs, KS, is a University of Kansas School of Pharmacy graduate in 1987. He owns 4 stores in SC, KS, and SWMO, and is the current president of the National Community Pharmacists Association, NCPA. Mr. Caswell serves as a board member for NCPA's Innovation Center, The Kansas Pharmacy Foundation is a past president of a Kansas Pharmacists Association and also serves as a lead network facilitator and luminary for CPESNKS. So a hearty welcome to you, sir. Really looking forward for your talk. So you can take over now, sir. Thank you.
Okay, thank you very much. Thank you, Robert. All righty. Jump on here quickly. Okay. Thank you, President Joshi. It's a great honor to present to you today to the Association of Community Pharmacists of India, a South Indian branch, upon the practice of community pharmacy within the United States. Good evening to everyone. My name is Brian Caswell, President of the National Community Pharmacists Association here in the United States. I greatly appreciate your attendance today, and I'll be covering several topics and issues of the day surrounding the practice of community pharmacy and the challenges that we face, along with some victories and advancement of our profession, and also, more importantly, opportunities in order to serve our patients and their healthcare outcomes. And I appreciate the bio that kind of gives a little bit of a background of what I have been involved with and what I'm involved with now. What I'd like to do is take a brief moment and kind of show you as well the stores that I own and my teams, so you can kind of get a visual understanding of maybe a feel for who you're talking to, more or less. And so I have 4 stores, like it was mentioned earlier, in Southeast Kansas, which is Kansas is the state that's centrally located within the United States, a very rural state as well. And then we have 1 store in Southwest Missouri, another rural state that borders right up against Kansas. So as you can see here, this is our team, an outside exterior of our stores as well. And we're very proud to be the local leaders and also a healthcare center for our patients. So just want to give you that visual perspective. As well, I might give you just a brief background of how I came to become president of NCPA. And how that really occurred is that I graduated in 1987 with a degree in pharmacy. It was before the PharmD degree that we have nationwide here now. So I have a bachelor's in pharmacy. I went to work for a national chain drugstore that was located within a grocery marketplace. Worked there for 8 years, and my father-in-law, future father-in-law, and became my father-in-law, had a store in Baxter Springs, Kansas, called Walker Drug. And the name there is his name. His name was Edwin Walker. And unfortunately, he passed away, and I stepped in and took over the family business. Consequently, after that, a few years later, I had an opportunity to purchase an existing store in Cherryvale, Kansas, and that became Cherryvale Pharmacy, and open up another new pharmacy in Galena, Kansas, called Four States Pharmacy. Our 2 owners that you'll see are, our pharmacists in charge within those 2 stores wanted to get into ownership as well. And so my business partner that I have within Cherryvale and Four States, along with our PICs, bought CJ Pharmacy and established that here just only about 4 or 5 years ago. And so my story really kind of takes on a national sense after I became president of the Kansas Pharmacists Association, and being a fairly active advocacy group within the state on both state and national elections. I had an opportunity to meet some potential candidates, and I helped one of those candidates campaign for a congressional seat against a very well-known former Olympian athlete, and who was a representative in Congress at the time. And this candidate failed, but she was grateful, and she tried again 2 years later, and she was able to unseat a 10-term sitting congressman, which garnered a lot of national attention. And she gave a lot of that credit in essences to myself and rallying community pharmacists within the state of Kansas to help her with her campaign and to bring healthcare front and center. She had a background in healthcare for herself as well. That allowed me to kind of catch the attention of the NCPA, who asked me if I would be considering of a position within their national organization, which I was very interested in. And what happened was I ran for that seat and was elected. The role in leadership within NCPA from the beginning to a final end is about a 14-year commitment if you withstand all the elections. We have 5 vice presidents that are elected each year, and they advance upward. And then we have 6 board members on NCPA. And then after your period of time there, you're usually asked to run for president, which I did and won. And I'm actually in my 2nd term of president, which is unusual. Usually it's just a 1-year appointment, but due to COVID, during our period of time that we had, which was right in the middle of my presidency, we decided that we would go ahead and try to allow me to fulfill my duties one more time in the midst of COVID. As you can imagine, many of you and all of our lives were kind of upended. And so I was grateful to have the opportunity to serve in the 2nd year. My term ends this October at our annual meeting, which we will have in Charleston, South Carolina. So that's my background. And I'll go ahead and jump on into the presentation here very quickly. So NCPA is considered the voice of community pharmacy. It was established in 1898 as the National Community Pharmacists Association, and we are a voice for 21,000 independent community pharmacies. And together, we represent over $75 billion of healthcare in the marketplace, and we employ more than 250,000 people across the country. This is, I think, very important as we see 2 aspects of NCPA's presence and membership opportunities for the pharmacists, independent community pharmacy owners across the country. One is that it's a fairly substantial dollar amount. We see quite a few patients. We probably fill right around 40% of all the prescriptions in the United States. And then we employ enough individuals within the states and within our local communities as well to create a presence within the communities. And along with that, the idea that we interact with our patients and have a great relationship with our patients. Therefore, I think we're considered, I would say, air quote, influencers, as the social media world calls it. So with that, we have a lot of legacy within the advocacy world, and that was my path, and we still continue to do that today. As we survey our members, advocacy is probably our biggest asset to membership. So, looking at independent pharmacy today, what does an average independent pharmacy look like? And each individual owner averages about 2.1 stores per owner. And each one of those stores fills roughly around 57,000 prescriptions in a year. It's evenly distributed between new and renewed prescriptions. The average cost is around $55.86. And as you probably are well aware, we have a very wide degree of costs within that number of prescriptions. I'll give you an example. We have a lot of generics. That's 90% of our dispensing. That is much lower than $55.86. And then we have some brand name drugs, which represent around 10% of our overall prescriptions. And the average cost on them is quite a bit higher. So, but with that 90-10 perspective, the average cost comes right around a little under $56. Now, when we look at the pay sources, that's where medications are being paid for and being covered by. This is probably one of the biggest challenges that community pharmacists here in the United States face. Basically, we have three different types of pay sources. The first one, the larger one for community pharmacy, is the government program. We have Medicaid, we have Medicare Part D. Medicaid is the assistance that is state-based. So for instance, here in Kansas, we have a Kansas Medicaid, and it's really determined on income levels. So low income level individuals who need assistance is covered under Medicaid. Medicare Part D actually covers those who are elderly, who are retired, and those who are under disability. And together, those groups represent about 55% of the payer source that we have here in the United States. Other third-party programs consist of commercial insurance, which is normally supplied by your employer. Not all employers offer healthcare coverage and therefore prescription drug coverage, but a vast majority and the larger businesses themselves do offer that, and that represents about 35% of the prescriptions that's covered in community pharmacy. The last 10% is usually cash. Some of those that may be also tied to some independent cards, prescription drug supplements from the various drug manufacturers, but mostly it's a cash type system. So within this group, within the government and the other third-party commercial insurance, we have a group of insurance, or there's a prescription drug insurance that's called pharmacy benefit managers. And those pharmacy benefit managers are just that. They manage the pharmacy benefit within a patient's healthcare. Usually they are subcontractors within the major insurers themselves. But as pharmacies are contracted with the PBMs, we directly negotiate a contract with them, and the challenges there are pretty great as the squeeze from the national coverage of these PBMs gets smaller over the time period. Our margins continue to erode, and it's difficult to operate a pharmacy, which is actually two things. It's a clinic, but it's also a business. And so from our perspective is that we have to have the business side in order to support the clinical side and the opportunities that we're able to give to our patients. As successful as the business is, most independent owners who are wanting very much to be involved with a patient's healthcare is able to invest his profit back into that business and within the clinic to support his patients. And so that cycle is what we rely upon for continued coverage and for actually advancing the clinical aspect to our patients. So as we look at the marketplace within the United States, this is a 5-year spread. Our latest data only goes out to 2019 as the data is lagging a little bit because of the coronavirus. And you will see that it's pretty much steady across the board. We see a very slight decrease in independents, and those are locally owned independents, where there's a slight increase within the traditional chains, which you might know as like CVS and Walgreens. Then there's also a supermarket, which is what I worked within. I worked within a company called Kroger, and they owned a small chain called Dillon's. I was there for 8 years and had a wonderful opportunity and experience there to grow my my clinical skills and at the same time get my managerial skills before taking on Walker Drug. And then finally, we had a mass merchant, which is the Walmarts, the Targets, and of the world. And so, as you can see, the vast majority is between the independents and the traditional chains for the numbers of opportunity of patients to access their community pharmacists. Here's a breakdown of across the country of where you see traditional change, the 4 categories I was showing you. And I might just draw a little focus right here within Kansas, as you see the breakdown, we have more independent community pharmacists than we do the other categories. That's generally true throughout all of the Midwest, as this is a vast rural area and it may not sustain a larger chain drugstore as well as a independently owned community pharmacy. We look at the population center of the country, and the vast majority being mostly on the East Coast. And as you look at those numbers, the proportion of independent community pharmacists is not up to the same level as the chains in many areas, but in some, they basically are. As you move west, the population decreases quite a bit until we reach California, which is the most populous state in the United States. And there you see chains and independents pretty much equal. And so that kind of gives you the layout of community pharmacists. And our memberships span not only the United States, but also into some US territories as well. So we did a survey not too long ago asking community pharmacy owners exactly what services do you provide within the community. And so we actually broke this out in two aspects. First off is services that's provided to patients, as you see on the left-hand side over here. On the right-hand side, you'll see how community pharmacists are involved within their local pharmacy, within their local communities as well. And on that survey, 85% of the respondents said that they are, quote, quote, full-line pharmacies. And that means they identify as apothecaries or compounding long-term care services, that they provide all the services or most of the services that pharmacy is allowed to offer within their local jurisdictions. And so like 92% provide wound care, 92% provide medication adherence and synchronization, 76% provide for home or worksite delivery, which has been very traditional over the number of years and not so much with our competitors out in the marketplace. They offer certain products like hemp-based products as well, which is fairly new and is growing. Compliance packaging is becoming, in the last 5 to 10 years, another big asset that's a patient-offered program that patients enjoy and allows them to be able to keep within their medication adherence as well. An interesting part here, I think, is 80% of them prior to the COVID outbreak were giving flu immunizations, which I think is a great number. I did not expect that number to be quite that high, but influenza vaccines has become such an important part of healthcare prevention in the fall in the United States that many community pharmacists have joined that call, where it has decreased among healthcare practitioners. Part of that may be due to general practitioners themselves in the United States has dwindled in numbers, and pharmacy has stepped up to help take care of that role of immunizations. It'll be interesting to see as we emerge out of this pandemic whether or not this 80% will increase, and I can't help but think that it wouldn't. And as you can see, there's a couple other aspects there of community pharmacy and how they involve themselves with products and services. One of the other thing is important, and I think that separates community pharmacy from their other local chain competitors, is their involvement within the community itself. Relationships is very near and dear to community pharmacy owners, and rightfully so, because we're taking care of family members, friends, neighbors, colleagues within the community. And so the relationship aspect is already there personally, and it just normally extends out when we come out to healthcare coverage. And as you can see here, 12% of the owners consider themselves lifelong friends with councilmen that have control over local and city government. Nearly 60% are members of Chamber of Commerce, and Chamber of Commerce are the leaders and directors and work very closely with local governments on increasing business opportunities and drawing patients and people and population to their local communities. As you'll also see here, the involvement means around 60% of the owners have said they have contributed and provided monetary support anywhere between 5 or even greater than 10 community organizations. And then 50% actually said that they contributed more than $3,000 annually into support of those community pharmacy or those community organizations. And then finally, down here, one aspect I'd like to bring forth is that we've asked for pharmacy owners and some of their employees as well to become involved from the decision-making standpoint. And so 6% of our owners said that they are an elected local or state office, which is very important. We've been pushing more for community pharmacists to be involved in the local, state, and even federal election process so that that voice of community pharmacy can be carried to those decision makers. And we're doing very well. We have a couple of community pharmacy owners that are now within the House of Representatives in Washington, D.C. And that has proved to be very valuable to have community pharmacy's voice there when questions arise. This next screen here, what I'd like to do is talk to you about the emerging models and also patient care services and wellness services that community pharmacy owners are providing. And so this emerging model part here at the very top is as you can see, collaborative practice agreements has become very important as we've moved along. So collaborative practice agreements are those where we work with local physicians in providing the opportunity to sit down and talk to patients on medication therapy management, vaccinations, and so forth. And as you can see, in a very short time frame, that collaborative practice agreement has increased. And again, I think post-pandemic, we will see that this percentage will gain even more further usage within the community. Access to electronic medical records is very interesting because that goes hand in hand with our medication therapy management with patients. You see a decrease here. I'm not really sure if this is really actually the case. Either our 24% or our 15% may be off, because I know that community pharmacists have been saying that they're gaining more access to the electronic medical records as healthcare professionals across the country are moving more out of a traditional paper roll to an electronic medical record, which allows more sharing and allows more data collection and data improvement so that we can utilize that to increase healthcare outcomes. A residency program is something fairly new. It's been very popular within the healthcare within the community hospital associations, but not so much within community pharmacy. And we are seeing a growth in that as we speak, and we will see that get better. Transitions of care program. It's the program that we have that where a patient is linked to a community pharmacy, and they get their medications. So when they are dismissed from the hospital, that they do not miss out on their prescription drugs and continue their medication therapy. Many times what we found is that patients will be dismissed, they'll be handed a prescription, and they'll fail to get it filled, or it'll be a large delay, which actually can endanger the healthcare outcome and could lead to readmission from that patient back into the hospital, which increases cost to the insurers and to the federal government as taxpayers. And so transition of care has become a bigger part of these extra services, these emerging models that we're talking about. And it's becoming something that community pharmacy has stepped into as they assist those patients in making sure they have their medications before they're dismissed and coming home. Other patient care services, as we see down here, medication therapy management, as I talked about, as you can see, is very widely utilized now. That was not the case probably around 15 years ago. The implementation of Medicare Part D and having access to prescription drugs for our seniors actually helped kick this along, and community pharmacists stepped up and started implementing this MTM program, which allows face-to-face meetings with your patients in an appointment-based kind of schedule model. I know that even though our relationships were great, this has been wonderful for me as I'm sitting down and talking to patients and assessing them and working together with their physicians. Compounding, for instance, here has been a large part of community pharmacy through the years, but as you'll see that percentage has decreased a little bit due to some challenges that's come across through regulations. And also at the same time, some community pharmacists who relied on compounding have now either transitioned out of community pharmacy, have retired, and so we've seen some shrinkage within the market. But compounding has probably become more important to those who are involved with it than those who are not. And basically, compounding, a definition here in the United States, is more or less taking raw materials and putting them together for a doctor's order and coming up with a prescription drug that suits the individual patient's need and that's individualized for their particular case. Durable medical equipments, durable medical goods is like walkers, wheelchairs, canes. Also means here in the United States, diabetes testing supplies and so forth. And then ostomy supplies are broken out. They're about in the same group. But as you can see, a good chunk of community pharmacies offer these as patient care services. Lastly, what I'd like to look at is the summary of the wellness services. Now, wellness services have been around for quite a long time, but within the last 10 years in the United States, they have grown substantially as pharmacists have transitioned out of the traditional dispensing role and have come into more of these other clinical roles, like we talked about earlier, immunizations, which are flu and also non-flu, blood pressure monitoring, diabetes training, and as you can see, weight management, lipid monitoring. These are opportunities that many community pharmacies have created within their practice setting to help their patients' outcomes. And that has led us into a opportunity that we thought as community pharmacy owners, perhaps a workaround to the challenges of being reimbursed for our medications. As I said, the margins has become thinner, and as pharmacy owners, we look to ways of helping our patient. We thought that perhaps what we could do is maybe offer the opportunity for these enhanced services that we just talked about in a group setting to a payer, a larger insurer, showing that the role of community pharmacy can actually help lower their overall healthcare costs and create better outcomes. And so NCPA, along with a healthcare group out of North Carolina, created an opportunity in a group called CPESN. CPESN is Community Pharmacy Enhanced Services Network. And like I mentioned before, these group of services that we offer here, along with other various ones as well, is what is a requirement basically for CPESN members to qualify in this group. And what we do, this network that we've created, they have a set standard of practice opportunities that we list here. Some also have home care delivery. They vary across each network. And we have over 40 networks within the United States, mostly scattered with individual stores within a local chapter, which is usually state-based. And what you'll see here in just a moment, we'll show you how that's scattered throughout the United States. But basically, what we're trying to do is reimagine the healthcare delivery in America. We still have traditional dispensing, but what we also want to do is be able to fill this gap that we are seeing with the lack of general practitioners within our local communities, but also give value-based healthcare delivery and savings for payers, and also better outcomes for our patients. So here's a snapshot that you'll see. And I know this is a little busy, but these are the individual chapters that we see across the country. Again, I'll point to my local network, which is CPESN of Kansas, that I am the lead network facilitator. And also as a NCPA board member, I'm proud to say that I was one of the board members that saw this opportunity and launched it a few years ago, and we've seen great success, and it's growing. I think this is going to be the future of healthcare delivery within the United States, and maybe perhaps across the globe as well, because as community pharmacy owners, we have a vested interest in our patients, and the middleman, the PBMs that work their way into our practice setting are determining amongst physicians the actual product selection for an individual patient, and then also is telling me as a community pharmacy owner how much they're going to pay. The issue and problem with that is that PBMs, there's only 3 that actually control over 80% of that of the payment source within the United States. That's a very, very big influence within the healthcare market, and they utilize that influence also in Congress as well. And that's who we're battling. NCPA battles with the PBM industry on those reimbursements, and also on the selection of certain medications for patients, as they are driving more selection from themselves on products for patients versus physicians. And so with that struggle, we feel like CPESN is negotiating directly with the health insurers and not with the PBMs. It gives us a better opportunity to have direct relationships with those payers. The opportunities that also CPESN did this year is that they stepped up and was a huge supplier of educational resources and access to certain products like PPE and also vaccines. And it's allowed community pharmacy to be one of the leaders of these services of testing the individual patients and also giving vaccines. And we're proud to be a part of the statewide access to vaccinations, and we feel like we've done a fairly good job in the United States with, I think, community pharmacy leading the way. We've seen roughly about 37% of the United States population has been fully vaccinated. It's not bad. It needs to get better, and it's going to get better. And it's going to take community pharmacy and their relationships that they have with patients to convince them to get beyond the hesitancy that we're seeing right now here in the United States. But it also, we were very influential in having patients come in and getting that initial 37%. Give you an example here in Kansas, we have roughly about 36.5% of our patients are fully vaccinated. And we are proud to say that we were, as Walker Drug here in our county, 21,000 population, we were able to achieve a closer to 36 to 40% of our patients as well, between 6 pharmacies that represented those 21,000 individuals. And 3 of those pharmacies, and half of them, were ones that were part of the CPESN network, and we're glad to say that we're leading the way. So as you can see here, this is some of the examples that CPESN helped independent community pharmacy owners to address the coronavirus issue. As I mentioned earlier, I wanted to kind of come back to what the purpose of community pharmacy and pharmacy in general, really, as we have a triad relationship between the physician and also the patient, an equal partnership within that relationship that makes sure that we have that we're there and we're able to work with the patient routinely in maximizing their healthcare outcome. In the United States here, the average community pharmacy visits with their patients 36 times a year, while their physician is only visited 3 or 4 times a year. And because of that, we are a huge influencer within patient outcomes, and also able to report back to the physicians opportunities that we think that are out there that may be being missed altogether. And so within this role here, we see patients as being the center of the healthcare delivery, and that relationship that we have and where community pharmacy falls within. Now, I'd like to take a moment here and step back and look at individual pharmacy practice and the role of how pharmacists work within the workplace itself. And what you see on the left-hand column here is the duties of pharmacists within the role of filling the prescription need, and also now this new role, this new clinical role as well. And obviously filling prescriptions and offering the expertise and safe uses has been there and will always continue to be there. We check for medical interactions, and we do some education, patient education. We also give flu shots. I will tell you that pharmacists were the only ones who were given flu shots in the country before COVID. But because of the huge aspect of inoculating, over 300 million people, we knew that access to immunizations was going to be greater. And so what we did is that we trained some of our certified technicians to help us take on that role as well. And I can tell you within my pharmacy practice, that's been huge. Instead of having just one or two pharmacists immunizing, we now have 2 or 3 pharmacists and also 3 technicians that are qualified to do that as well. And of course, overseeing pharmacy technicians and interns and just having a role within the practice setting altogether. And so pharmacy technicians, we have a couple of different levels of pharmacy technicians and interns. We have certified pharmacy technicians who have a greater role and opportunity, like I said before, giving immunizations, actually entering in data. Some states are allowing them to do a final check of the prescription before it goes out, as pharmacists are getting out of what we call the bench role, where you're behind the computer, behind the bench, checking medications. As this clinical role evolves, we're doing more of coming around the bench and speaking more to patients and spending more time. And in order to allow the dispensing role to not be, and the workflow itself not to be disrupted, technicians are taking on a greater role. And so as you can see, traditionally they help prepare medications, and some of those non-certified are also helping take care of controlled inventory and actually answering phone calls and kind of playing a gate monitor for prescriptions as they come through, and able to push the need at the moment of that patient or the order to the right individual. And so,
hey Brian, sorry, my throat caught. We have some really great questions in the chat, okay. So I wanted to give you a heads up. Probably whenever you transition to the next slide, we can take a moment and address some of these questions.
Great. And that's Carly Traylor with NCPA, and Carly, she's with me. I appreciate that very much, and we will do that. So, a role of community pharmacy. How do we? How does a pharmacist become a pharmacist? And what I want to do. This slide is very important. It's great. I want to give kudos out to the University of Hawaii at Hilo, and you'll see that it starts with intermediate and middle school. It goes to high school. As individuals are looking to become healthcare professionals, they can see an opportunity of attending a college, either in a pre-pharmacy program or getting a full 4-year degree. Then they apply to the College of Pharmacy, which is a 4-year program. After that, they take a national exam, which allows them to obtain a state license, and then also a local state law exam. And after they pass that, they have all these different career options and opportunities out there. And there are many, many of those. So, just to show you that we have about right around 60,000 students enrolled in 140 different schools across the country. And so community pharmacy is still very well sought after as a profession. Last point I'd like to just bring out, and because I want to save time for questions, in that in our battle that we had with the PBMs, the pharmacy benefit managers, the biggest challenge that we had is that many times they hid behind an obscure law that said that they could not be regulated at the state level because of a protection of a particular law. This has been going on for a number of years, and 2015 there was a ruling in Arkansas that said that state legislatures had control over how they could regulate the PBMs within their individual states. It was appealed. Community pharmacy lost that appeal. And then later on, the opportunity for this case to be brought before the Supreme Court of the United States came about. And we had a ruling in December that said states do have that right. And what was interesting to us is that it was a unanimous decision, which is a huge victory for community pharmacy, as we see now more local control over those insurers and having more of an influence on them and having them fit the regulations and having them also adhere to more clinical standards and opportunities for patients and for healthcare practitioners to practice within their communities and serve their patients. And so with that, I wanted to say thank you, and thank you, Carly, for reminding me on this time. Sometimes I get a little windy, Dr. Joshi, and I apologize. I'm very proud to be a community pharmacy owner and a practitioner, and I can never see me doing anything else. So let's go into questions if you don't mind.
Absolutely. So our first question that we got was about, can you elaborate a little bit more about the opportunities for pharmacies to provide compliance packaging to patients? And then we had a question a little bit later that's related and said, how has COVID impacted overall medication compliance? So you've got explain about compliance packaging, but then also kind of shed light on how COVID has impacted medication compliance overall.
Yes. So interestingly enough, about a year ago, when the pandemic really started in the United States, and it was around March of 2020, one of the things that we saw was patients not wanting to come out into community pharmacies and exposing themselves to other individuals. And so we saw an increase from a normal 30-day supply to 90-day supplies. Along with that, patients were, wanting to keep track of this larger number of prescriptions and the daily routine. And so when you have 10, 12 different medications, it's hard to keep track of. And so many of them are seeking individualized packages or maybe cards that held their medications that allow them to keep track of taking their medications properly every day. And so we saw an increase on that as patients were seeking that. But at the same time, we saw family members who had elderly family members at home who were trying to take care of their medications, see this compliance packaging as being an important aspect in delivering their medications as well. And so community pharmacies have stepped up. It's been a growing opportunity in the first place, but we did see an increase with the coronavirus response here in the United States. And what was the second part there, Carly, again?
So it was talking about how COVID has impacted medication compliance, and just anecdotally, like MedSync and Med Compliance is a big passion of mine. And we saw a lot of our members doing basically like rebranding their medication synchronization programs to COVID protection programs. So helping patients not have to come to the pharmacy so often in the month. So we saw independent pharmacists really stepping up and helping address medication compliance. So she was just asking for your perspective of how COVID in general has impacted medication compliance.
And one more aspect on that, if you don't mind, is that the delivery system as well changed dramatically. We have a drive-through for patients to be able to not have to come into the store, and they could drive to our drive-through window and pick up their medications. It was a fairly big aspect of our delivery system. However, we saw a tremendous increase from patients, and at the same time, our home delivery more than doubled as well. And so we had one delivery car that we utilized. We ended up having to go to two as we expanded our home delivery. So we actually shut our lobby down a couple of times throughout the last year in order to help mitigate the aspect of being exposed to individual members. So anyway, thank you for that question. It's a great question.
So the next question we actually got a couple of times. So they want you to kind of shed some light into electronic prescribing and what pharmacies do to ensure, that patients that those e-prescriptions are error-free and that you're preventing fraud. So if someone were to have sent a prescription illegally or outside of the traditional way.
Yeah, that's a great question. Electronic prescribing has been around for well over a decade, and it became more sort of mandated. It's not really, it's an absolute, but there was a push, and there was a financial incentive to physicians to switch over to electronic prescribing, again, in order to be able to fall within that electronic medical record and having access to that particular data. And so the federal government spent an enormous amount of time and finances and resources into making sure that it is safe and that it's free of any fraud or any kind of manipulation. And we do have a couple of companies within the United States, and one in particular that's probably the majority user, allowing that transition of that electronic data from a physician to a pharmacy, and it's directed by this organization. They are very highly secure, and they've invested a many number of dollars. So I think overall we feel like it is very well secure and free of fraud, and it's shown to be the case over a decade now. So
awesome. So one audience member pointed out that with the emerging models enhanced services pharmacies, the collaborative practice agreements have actually shown phenomenal growth from 33 to 43 in just 2 years. Can you shed some light on some specific reasons for that growth?
Yes, for right off the bat, I will tell you that as patients hunkered down, they did not actually go see the physician as often. And so initially what we saw was patients missing appointments or trying to be rescheduled. Eventually that led to some more electronic type means. We had virtual meetings between patients and physicians. And so what we saw was that since patients weren't going in directly to maybe pick up a handwritten prescription, physicians turned more towards the electronic healthcare record. And they have access to that within their own electronic healthcare record. Exists an electronic prescribing methodology, and it keeps better record keeping for all of us, for both pharmacists and the physicians. And so I think that was the biggest driver of all during the coronavirus. And also, again, there's been a push from the federal government and also insurers to increase the use of that electronic prescribing.
Awesome. So then our next question that we had was on how do you cope with mail order pharmacies? So that drive to online pharmacies.
Yeah, that's an excellent question. And that's been a growing market and a competitor to us because many of the mail order pharmacies are owned by the insurers, the PBMs themselves, which creates a challenge for community pharmacy in the fact that we are sending all of our data and we are to our competitor, and we're being paid for by our competitor, which is, as you can imagine, not very fair and allows to have the eyes of our competitors within our businesses. And so self-fulfilling, we've seen the insurers push more individuals into their own mail order product. And how we compete with that is that patients have choice. And we can usually compete with them many times from a financial standpoint, but also just from a ease of use, because Give you an example, many patients are required to have 2 weeks of ordering before they are able to receive their product. So there's a big gap. Sometimes orders change on a per appointment basis. And then therefore you're out another several weeks before you get the right medications in. So convenience to patients, I think allows us to compete with that. And also a lack of relationship, as I told you how important the relationship was between a community pharmacy owner and pharmacist and the patient, doesn't exist within the mail order aspect. And so people value that. And when they're given a choice, they overwhelmingly choose their community pharmacy.
Thank you, Brian. So the next question that they have is, do pharmacies ever pay physicians to prescribe particular brands? So maybe you can expound on some of the kickback laws that we have in the United States.
Yes, there are some laws that do not allow physicians to be influenced to prescribe a certain medication for a monetary kickback, more or less. Also, physicians aren't allowed basically to own services that also allow revenue to flow back to them. So it's highly discouraged that physicians own any pharmacies, but for instance, they can't own a durable medical equipment facility because of the conflict of interest. And so there are some good laws out there that do not allow physicians to be influenced in that, and really more or less making the right product selection for the patient based upon their need and not so much for their own personal gain.
So this is a more recent question, but it's connected to what you had just answered. Do small manufacturers pay prescribers to write for their brand? So maybe share a little bit about kind of the drug company industry and through their outreach to local physicians, what that looks like.
Yeah, and so again, the kickback laws that are in place do not allow payments. But there was at one time, not that long ago, maybe 10 or 20 years ago, physicians weren't allowed to be paid, but they could be influenced by, you could take them on trips, you could buy them dinner, you could do all these other things to work around that monetary reward. And that too has been reined in quite a bit, actually to the point where not that long ago, manufacturers weren't even allowed to have their own ink pens with their company name to be given to physicians. So there's been a really big crackdown on influencing that decision-making process, so that again, it's more patient focused rather than personally gained. So yeah, great questions, because I forget, we've been dealing with that for so long, I forget that in other countries that may not be the same. So appreciate that.
Thanks, Brian. The next session they have is to elaborate more on the community practice residency programs.
So yes, so the residency programs come in 1 and 2 year programs for most of the community pharmacy-based residency programs in the United States. And basically upon graduating and obtaining your license to practice, there are community residencies. And like I said, most of these really fall within the health system or hospital settings more so than community pharmacies. But you're allowed to come into a residency community program and practice as a pharmacist. Most of these are really kind of concentrated on certain niches within community pharmacy. It might be diabetes care, it might be elderly care, it could be vaccinations and so forth. But many of them are focused usually on a certain niche when a particular resident wants to focus on a certain aspect within pharmacy and get that training, and then go into the community pharmacy environment and marketplace. And they are looked upon as a higher asset because of that extra amount of experience within the marketplace.
Thanks, Brian. So the next question goes back to that table that you showed, where over the course of several years, independent pharmacies versus chain pharmacies versus mass merchants. So are we seeing that independents are losing ground to to chain pharmacies, and what are some things that NCPA is doing to encourage independent pharmacy ownership?
Great question. And so I may take the latter and then kind of back up a little bit. NCPA values its members and the services that they provide to their communities. And so what we do, we give them business acumen, and we also allow them to have increased clinical access to resources that helps improve their pharmacy practice, and in turn helps out patient outcomes. And so as a resource, NCPA is by far and away probably the best national organization for its members. And at the same time, we are an advocate, a voice within the state legislatures and also at the federal level, and especially at the federal level. There is an old saying with NCPA is that you get into politics or get out of pharmacy. And the reason being is because regulations and the laws are highly influential upon the pharmacy practice itself. So you probably heard this saying, you need to be at the table. If you're not at the table, you're on the menu. And we've seen that become the case. So NCPA has dedicated itself to making sure that community pharmacy has those resources available to allow them to practice and survive as a business. Yes, we have seen a consolidation within community pharmacy over the past decade. We've seen a shrinkage of around 4 to 6%, and part of that's because community pharmacies have been owned by elderly, or not elderly, I should say, but older owners, and as the margins have shrunk, the opportunities for them to sell their businesses off to another independent owner has become a little more challenging because of the profitability and lack of profitability that may be as an opportunity for an ownership. For those of us who are kind of the older generation who've been around for quite some time, we've been through these ebbs and flows before, and we know that community pharmacy will survive. And we just have a little bit of a lull right now, but I see a bright light ahead of us as clinical opportunities become more important and the role of community pharmacy increases. So shrinkage in the market, but I also think that there will be some growth opportunities as we move forward.
Thanks, Brian. So can you explain a little bit more about how online refills work and home delivery within independent pharmacies?
Yeah, so I will tell you I'll just anecdotally tell you my story, is that we created a number of years ago an app for smartphones, and we also have a website. We give patients an opportunity to reach out to us to get resources for themselves on individual medications and also refills, and trying to make it as easy as possible. Medication synchronization has helped along that line as well. And we also have text-based communication with our patients. So we give patients every opportunity to be able to either call in, text, or be able to refill their medications online or through their app. And so it's been a big asset to us as we're able to streamline our workflow system, and it's made us more efficient here. I think there was another aspect I missed on that, Carly. Was the last part? Electronic refill?
No, I think you got it.
Okay, that's good.
Yeah. So this next question is, how do you handle expired drugs?
So we have a company that actually comes in, and we go through our shelves and pull products that's about to expire. Sometimes we miss a few, and some got to the expiration date. We're able to catch those, and we collate those. And we have an individual that comes in, collects them, and they will return those products to the manufacturers. And hopefully we get a better reimbursement on those products that we have. But over the number of years, that amount has decreased to the point of where we don't get anything back for those. So inventory management has become very, very important for us here in the United States. And at the same time, I will tell you, as I've talked to some of my older colleagues, is that we've seen expiration dates actually get smaller over the years. I remember when I got out of school, it wouldn't be unusual to see a product last 4 or 5 years on an expiration on the shelf. Now, if we see 2 years, we're lucky. And so that is a challenge on inventory management, which has a direct impact to the bottom line.
Thanks, Brian. So let's see, this next question. Let's kind of expand a little bit on those online refills. How are you handling refills of controlled medications, so like narcotics and sedatives, during COVID?
That hasn't changed really much during COVID, other than the fact that patients may not be seeing physicians as often. In the past, what would happen, it would almost be mandated, depending on the practitioner themselves, whether or not a controlled substance is required a face-to-face visit. And that has changed a little bit. So physicians are able to put refills on some controlled medications. There are some that they're not allowed to put any refills on at all. But if they have refills and if a patient indicates it's time for a refill for them to obtain, they can do so. And it falls right into our pharmacy management system, which we rely on very heavily as a manager of that workflow. So it comes into our workflow. We see it. If it requires a refill, we can electronically send that refill to a patient, to the physician, and the physician will respond in kind electronically many times as well.
Excellent. So I like this next question because you have this, you're the perfect person to answer this, is how do, or how have pharmacists evolved to start, providing point of care testing and immunizations when that hasn't been incorporated into like the academic curriculum until recent years? So how has pharmacy as an industry grown and coped with those changes?
Yeah, actually, I'll take that in actually two segments or two parts, because immunizations have been a part of the academic model here in the United States. I know at least in Kansas for around 30 years now. But the opportunity to give those vaccinations really didn't come to, I would say, full fruition until the late 90s. So it's been around 20 to 25 years that pharmacists have been doing that, and it's considered a standard care practice now. As I would say, more, for instance, influenza vaccines are given by pharmacists now than any other prescriber in the country. From the point of care testing, that's still a challenge. It's also evolving as we're going along. COVID did give pharmacists the opportunity as access points for testing, as that's become much more important. I see post-pandemic point of care testing being one of the new frontiers and being also a very important aspect of practice, especially within that group of CPESN or those enhanced pharmacists that work within that network.
So Brian, describe the role of the community pharmacist in the patient care process and how that differs from inpatient care. So in another way, like how can community pharmacists impact outpatient care?
That's a great question, and I'm going to go right back to relationships. And also, I may even evolve into like the vaccination process as a great example of how relationships have an impact on patient care. I have many patients who are hesitant about getting the vaccine. They've come in, they've actually created an appointment to meet with me and sit down personally and ask me how I felt about the vaccine and to answer their questions and their fears. And so I think that has a direct impact upon their decision-making process, which I think in turn has them make good choices, which I think impacts their healthcare, which I think in turn actually helps create savings to payers. So it's a win-win altogether. And we're very, very proud to be a part of that and utilizing that relationship opportunity with our patients.
Thanks, Brian. So the next question we have is, how do you handle transfers? And I'm going to add a little bit to that. How do you incorporate pharmacy students into transfer workflow?
Yeah, actually, yes, that's a good question. Most of the time, we have basically two avenues of transfers between a patient's obtaining medications at one pharmacy over to another. And most of the time, it's phone call driven, and at least an initiation, and we can give the information over the phone by voice. Also, they can request electronic transfer of those. Normally that doesn't happen within that same electronic platform that we have within physicians. It's usually fax-based. And especially if you got large amount of prescriptions that you need to transfer, usually that helps speed up that process. And and as we become more of a transient society, it seems like people going here and there, we see people doing many transfers to and then back again. So it creates a little bit of a challenge in the workflow of the day, but it's not too bad.
Thanks, Brian. So the next question is about over-the-counter medications. So how are OTC meds regulated in the community pharmacy setting? So speak a little bit towards that.
Yeah. So there's not as much regulation as you can imagine on over-the-counter or OTC medications. And pharmacies vary quite a bit in their providing of those products. We have some that have, we call that area a front end here in the United States, because the back end is really the pharmacy counter where we do most of the prescription filling. And so on that front end, we have some that have no front end at all. Absolutely, it's an apothecary style pharmacy, no front end whatsoever. They might have a few OTC products behind the counter that they might recommend and then sell. And then there are some pharmacies that's it. They have a huge front end and not much of a back end. So we have that wide varying gambit of pharmacy practice, but basically most pharmacies have somewhat of a front end, and they utilize that as a part of their consulting with patients, and as whether or not a patient presents themselves with a condition. And from an assessment standpoint, I as a pharmacist think that if they need to go see a physician, we refer them to their local physician or to a hospital setting. And at the same time, if we can actually help them treat that issue that they have with over-the-counter medications, we show them that product, and again, based upon that trust and faith that they have within us, they take those up quite often. So here in our store, we have quite a wide variety. I'll give you an example. 1/3, we have about 3,000 square feet in the pharmacy here in Baxter Springs. 1/3 of that is attributed to over-the-counter medications, and we're proud to be able to offer that a wide variety for our small community here in Baxter Springs.
Thanks, Brian. So next we want to talk about what are the kind of the differences in the patent progress or process for brands versus generic medications.
So in the United States, it varies, and it's been varying a lot more during the COVID because we're looking at opportunities of bringing products that can help treat patients' needs more quickly to the marketplace. And each individual administration may have an influence on that. It's become somewhat of a campaign slogan on trying to lower prescription drug prices and having access to those products. But most of the time, it's a new drug application when submitted. It takes about 17 years within the chain of development to actual delivery to patients. And many of those years are eaten up within clinical trials. The United States probably has a right reputation of being very focused on those clinical trials, and it holds up those products coming to the market, probably more so than what the manufacturers really want to. But the FDA, the Food and Drug Administration, has control over that, and they're proud of their track record as to making and that track record has allowed them to have a safety record that's pretty good. So anyway, yes, there is that patent protection, and they can actually ask for an extension on that. Sometimes they get it, sometimes they don't. But the generic process and getting patent products to generic access is very, very important when we come to control of medication prices, because there's a huge difference there usually.
All right, Brian, I think we have time for one more question. So so Dr. Joshi, let me know if we can go over a little bit with time. But this next question is about opioid regulations. So has COVID impacted regulations for opioid prescriptions during lockdown? So just in the last year, have we seen any regulation changes?
Yeah, if I could, the precedent up to that in the last 10 years, there's been a major push on controlling opioid dispensing, because I'm sure you've read and you've heard about the opioid crisis that we've had in the United States, and it's become a legislative issue as well, as it should be, and also a healthcare issue, as many community pharmacists are the gatekeepers for those products. The onus on community pharmacy owners has been increasing quite a bit. What we saw was, I think, about 10 years ago, a hard push. It kind of leveled out just a little bit. During the COVID crisis, we didn't see, I don't think, a higher push. However, we're seeing maybe somewhat of an emergence of maybe a little bit of an uptick in certain areas, as maybe the focus hasn't been on proper opioid dispensing, and we kind of took our foot off the pedal a little bit. I'm sure that's going to be coming back. Regulations are still there. I think there'll just be a greater focus on it. But the opioid crisis is a big political aspect here in the United States, and we'll see more of a focus post-pandemic on this.
Yeah.
Yeah.
So,
Hello.
Dr. Joshi, we have a couple of questions left, but we can respond to those offline if we need to be conscious of time.
Please go ahead.
Okay, so this next question that we have is actually about Indian pharmacists seeking to move to the United States. So saying, how could an Indian pharmacy grad get a job in the United States? What are the steps / how hard would it be?
That's a great question. I'm not sure if I'm going to be highly qualified to answer that as well, but it's my understanding, and this is Brian Caswell's understanding, of course, is the fact that I believe that there is a reciprocal process on training in India that's approved by the individual states here on recognition of the formal training. And if it's recognized, I think you can apply for a license just like any other US-based pharmacist. And if not, I think there's been some workarounds on that. Maybe some equivalency type tests or whatever that case may be. That part I'm not 100% sure of, but I do have some friends and colleagues that have made that transition and are happily practicing in rural and in also urban areas. One of my most, as being president, and sorry, but Dr. Joshi, if I'm going to get off here just for a second. One of the best aspects of being president is meeting pharmacists from all across the country. And some of the most rewarding relationships that I've built have been with some pharmacists in New York City, where independent community pharmacy, even in the most densely populated city in the United States and in the world, community pharmacy is thriving. And some of those owners came from India. And they have been an absolute joy to get to know, because their pharmacy practice within New York City is completely different, and in some cases not so much, but completely different than it is here in rural America. So sharing those best practices has been a valuable asset personally to me as well.
So Brian, I'll add a little bit to that just to emphasize that our licensures are tied to our states and not a national licensure. So if you work for, say, like the Veteran Affairs, like there's certain aspects where like you can have one license and work in multiple states. For me, I'm licensed in the state of Georgia and the state of North Carolina, but I live in Virginia. So I don't practice pharmacy in Virginia. So it's very state-based, and every state has their different regulations for what constitutes. So as the state of New York may be different than if you were to go to, say, Wisconsin to try and practice pharmacy there. So it's very state specific. But excellent.
Thank you, great.
The next question is about academic change. So this is another one, Brian, I'm happy to help with that, answering this. So academic change in India requires a lot of effort. How does that differ from the United States? So whenever they're trying to update curriculum to keep pace with, pharmacy practice, how does that differ from India?
Okay, I will have to pass that along because I'm not sure how that works within India, but I do know as an advisory council member to the University of Kansas School of Pharmacy is that staying ahead of that pace has been a challenge, but it's also very rewarding. And I'll give you an example. CPESN, as it grew, has now incorporated itself into the academic workplace, and so now it's an integral part, and the students actually love it because they feel like that they actually get to practice what they're actually taught. So so I don't know if you can put more into that, Carly, as from the differentiation between the two countries.
So I would say that we're a national association, NCPA. There's a national association for colleges of pharmacy, so AACP, American Association of Colleges of Pharmacy. And so they advocate for regular curricular updates. So a lot of the faculty members that I interact with across the country, I think it's 4 to 6 years, they have to do like a curriculum overhaul. So it's kind of built into their standards when it comes to their school accreditation, is that they must update their curriculum. Now, I will also comment that the colleges of pharmacy in the United States could do a lot more to advance community practice education, because community practice is advancing at like light speed right now. And so we do have organizations like ACT. So this works in tandem with the Community Pharmacy Enhanced Services Network that Brian was sharing earlier. So it's faculty members who are advocating for progressive education with community pharmacy. So we have, I think, 80 plus schools, and we have about 130, 140 colleges of pharmacy in the United States. So 80 plus schools are advocating like very strongly for those changes to happen. So I would say it's not perfect, but there are some fail safes in place to make sure that the curriculum matches practice, right? So we want to make sure that our students are at the cutting edge of pharmacy practice for sure. All right, so let's see, we're just at the bottom. Okay, so I like this question. How can pharmacists provide, or what services can pharmacists provide outside of counseling and dispensing? So we've listed a couple. So Brian, just for you to reiterate, what are some of those enhanced patient care services?
Yeah, they're wide, and actually those niches are many times created from some community pharmacy owners themselves, and just creating some of those new niches. But the one thing I hate to keep harping back on CPESN, but CPESN has been a great advocate for community pharmacy and those services that's delivered. But for instance, we never really took a blood pressure check many times before. Well, now we have a practice setting that's actually set along that line. So from a cardiovascular standpoint, a diabetes standpoint, we're doing more blood pressure checks, we're doing A1C checks, and we're keeping those records and helping monitor patients as they progress through their disease state. And it's interesting. I think there's been another aspect of this, because patients before didn't care much about, I mean, I shouldn't say they didn't care, but they probably weren't as focused on their disease state until they went to see their physician. Well, now that they see their pharmacist more often, they're asked that question and they're engaged within their disease state more often, which I think brings more awareness to themselves, and I hope it creates a better outcome as well.
Absolutely. So Brian, this question is more specific to what Indian pharmacists are seeing today. So since mucormycosis, so I apologize for my pronunciation, is highly drug resistant, does community pharmacist / pharmacy have any role in improving the clinical outcomes of this emerging pathogen, especially in COVID-19 recovered patients? This is a situation that's escalating day by day in India. So I'm not super up to date with that particular pathogen. So what in your practice have you seen with that particular pathogen emerging in COVID recovered patients?
Yeah, that's a great question, because we've not seen that, at least as far as I know, here in the United States. But if presented with a case like that, identification of individual patients and making sure that they're being cared for properly, and that many times it's not allowed just to continue on, I think is a role of community pharmacy, because we are the healthcare resource and the voice of healthcare in many, many communities. I'll give you an example. Like in Kansas, we are a very rural state. We have a little over 2 million people within the state. Probably half that population might be scattered between the 5 or 6 larger cities. And then we have a very large rural community that's agriculturally based and so forth. So if we see issues like this emerge, it's going to be the role of community pharmacists to identify that and to get that patient to the proper healthcare provider so that we don't have a further spread of challenges like this. And I think we're going to see this also with the variants, even though community pharmacy may not be able to do a sequencing of the virus, that they can get them to the right lab so that the state officials can identify those emerging variants within communities and hopefully suppress the acceleration of pathogens like you just mentioned, or perhaps other variants as we go along as a prevention.
All right, Ryan, this is our last question. So what we're seeing in India, in these high population areas, what are some things that pharmacists can do to help support patients in those highly populated areas during COVID? So kind of leaning on some of your experiences with your colleagues, say in New York City, what are some things that they were able to do and services they were able to provide during this lockdown period to keep, the quality of patient care where it should be?
Yeah, a great question as well. And I will tell you, those colleagues that I visited in New York City, I think at least here in the national media within the United States, and I'm assuming across the world, New York City took on the role of being ground zero for the pandemic about a year ago. And so visiting with my colleagues on how they were more or less addressing the needs, as access to healthcare providers decreased, as we went into lockdown and people stayed home, having access to patients was very important. And we did see some acceleration into questions and to some resources that patients were looking for, they always had access to from their community pharmacy. They accessed us through social media, for instance, and we saw our social media use just absolutely explode. And so really, I kind of consider us the wellness well of the community. And so people come to us for information and for questions, sometimes not pharmacy related, I will tell you at that. And some of them are kind of challenging, but being that resource, they rely on us heavily for many, many questions. And so creating an avenue of access for them has created some new opportunities for us. Like I said, in social media, and of course the phone is always available as well. But we saw quite a bit of communication along those different varying telecommunication devices increase quite a bit because we were locked down. We didn't allow patients to come in, and they still needed access to healthcare.
All right. Well, Dr. Joshi, I'll go ahead and pass the mic back to you. That was all of our questions.
Thank you so much, Carly, for making it very interactive, and really it was very excellent session. And I really appreciate, the patience and knowledge of Brian. And I think we have with us Mr. Gopinath, who is one of the senior most pharmacy officer, and he's a representative of the Government Pharmacy Officers Association of India. Gopinath sir, one small question. Go ahead, Gopinath sir. Mr. Gopinath.
Hello?
Yeah, we can hear you.
Thank you. Respected President, latest side of the country, and associated members, it's a very happy and great honor to be associated with you. As a part of this program, I have a couple of questions. Pharmacists are well respected, recognized, and well-paid job in United States of America. What would be the reason? And second one is, do you have any mechanism to control the entry of pharmacists into community? So you will be appreciated.
Carly, you're on mute.
Are you audible?
No, you have to speak a little louder.
Carly, I think you're on mute. Still there?
Mr. Gopinath, only one question because we have, the scarcity of time. Please speak louder.
Dr. Yossi, I missed the question. I don't know if you could.
I'm asking him to repeat it.
Oh, okay.
Even I could not hear well. Okay.
As great as this telecommunication world we have and Zoom calls and everything, we still have challenges to meet.
Yes, yes. Are you able to ask the question, Mr. Gopinath? Okay, Pavitra, we can come back to him later.
Yes,
can you
sir.
kindly proceed with the next aspect?
Yes, yes, sir. Firstly, I would like to start by thanking Mr. Caswell and Carly Taylor for wonderfully carrying out the Q&A session. It was wonderful. Thank you so much. So now may I request Professor N. Udupa, Executive Director, ACPI, to felicitate our speaker.
Yeah, it was very nice, Dr. Brian Castle, moderated by Dr. Carly Taylor. It was a very great session, and it is one of the international first event we have conducted. So it was very nicely presented from A to Z, from community, clinical, and with the various drug interaction and over-the-counter prescription handling, opioid handling, and so many aspects are very nicely explained, and he has not left every question and every this is very nice answers and clarifications are given. And today great learning was there, and we Indians have, particularly the community clinical pharmacy side, we have learned a lot of things, and it will also help us to take forward some of the very good things which are happening in under, and with the great experience he has authoritatively has given this lecture. So I have great pleasure in felicitating him and giving this certificate by our to Brian Caswell, President of NCPA USA, on behalf of our ACPI, Indian South India chapter. I wholeheartedly appreciate this event, and Dr. Nagappa Nayak, Dr. Joshi, and all the people who have attended this. We appreciate this particular interaction. And once again, our great appreciation and felicitation to. So we present this certificate to Dr. Brian Caswell from our ACPI India chapter. Thank you.
Thank you. And I would like to extend out an invitation as well. If there are any further questions today or in the future, please reach out to NCPA. We're here. We're a part of a global community of healthcare practitioners, and we embrace all pharmacists across the world in sharing best practices and just meeting the challenges for our patients. So thank you for the opportunity today to all of you. And I look forward to being in further communication if you'd like. But I wish you all the best, especially during these challenging times. And please use us as a resource if you would like.
Yeah, Pavitra.
Thank you, Mr. Caswell. Now I request just pardon me 1 second. There's a glitch. So now I request Professor Ananta Nayak Nagappa, National President ACPI, for the presidential address.
The things have begun in a very big manner by calling Dr. Brian Caswell for their inaugural international lectures. Dr. Anand Joshi and his team should be congratulated for conducting an excellent session. And it was a great learning experience for all of us. Although I have tried my exploring the knowledge about US pharmacy, today so many things were clarified. And I think we have to take the moment further by adopting some of the practices which was described by Dr. Brian Castle in his lecture. The services are more important rather than the product. So we should move to the patient-centric, leave about the product. Products are manufactured in a wonderful manner, which is accepted by all over the world, even in USA. But how do we use it? It's a big challenge for all of us in India. And we are having a lot of problems in using because there are so many conventional things which are coming in the way to learn, to adopt new things in the society. Many of my students work in New York and other places also, Florida also. So they also interacting with them. I have learned that they also have to struggle a lot to come to this stage and attain a status of what community pharmacy enjoys today in US. So like that only we have to struggle. So the academics and as well as the practicing pharmacists both are in a big mood after this lecture to take the momentum further. Thank you very much, Anand Joshi. Please continue this type of educative programs in the future. And also, apart from it, we have to start some training programs which can be more effective in implementing what Brian Caswell has discussed in his lecture. Thank you very much.
Thank you, sir.
Thank you, Clary Taylor, for a nice interactive session. Sorry.
Thank you so much, sir. So may I now request Dr. KSG Arul Kumaran, Secretary, ACPI South President, ACPI Kerala, for the word of thanks.
Thank you, Pavitra. The best and beautiful things in the world cannot be touched or even seen. They must be felt by heart. Thank you is one of such prayer among them. I consider it a great privilege to propose a vote of thanks to all the dignitaries who have witnessed it as a memorable and successful webinar. Today, my words are not enough to express the gratitude. On behalf of Association of Community Pharmacists of India and KTN College of Pharmacy, Kerala, I would like to thank Mr. Brian, President NCPA USA, who graced us with his thought-provoking session and revealed some interesting facts. The point where the speaker told us about the role of clinical pharmacists in immunization was really informative. I'm pretty sure the quantum of knowledge that the speaker gave us will definitely help our pharmacy students to understand what is the role of clinical pharmacists in USA. And this is for your kind information is that Mr. Brian is a leader in his community and donates 10 gallons of compounded hand sanitizers, not the ready-made one, compounded hand sanitizers to the people over his place. Really, I thank him. And the way he answered all the questions which were raised by the delegates patiently, it was very awesome. Thank you, Mr. Brian. The work you are doing for your community pharmacy people is awesome. Friend in need is a friend indeed. In this connection, I thank my beloved friend, Dr. Joshi, for his motivation and his vision towards the pharma education and research. 2 days back, he called me, will you deliver a vote of thanks for this forthcoming seminar, which will be held on 20th of May. I immediately responded to him, yes, I will deliver. How can I disobey his word? He is such a potential candidate in our pharma field. Thank you, Joshi, for being with us today. And my thanks are also due to Dr. Anand Nagappa, Mr. Udupa, Mr. Gopal, Mr. Srikanth, Mr. Gopinath, Ms. Pavitra, and Dr. Nagavi, who blessed us with their a personal inspiration of busy schedule. My dear students, never give up until you achieve your dreams, and dream big and go for it as long as you can. My dear friends, success is only for those who work hard and run till the end. So friends, run your destination with the strong determination. Once again, I thank you all for your attention. Stay at home, stay safe. Jai Hind. Thank you.
Thank you. Thank you so much, sir. With this, I would like to thank the guests, delegates, and coordinators for patiently listening and for their active participation. Thank you, one and all.
Thank you once again, Brian, for your wonderful talk and making it very successful. And thank you, Carly, for your wonderful interaction. Thank you, friends. Let us catch up very soon with one more informative talk, and let us make pharmaceutical care everywhere. It is not only in India but across the world. Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you.